Start, sir.
So, good afternoon once again, students. So, today's topic will be on oral hygiene index simplified. So, what is the purpose of this? Who proposed this index? In which year? Okay, all those things will be seen. Okay, so, if you come to oral hygiene index simplified, it was proposed by Johnson in the year 1964. Actually, what happens? In the year 1960, they proposed the original index. But this index, when we are using for a mass population, okay, epidemiologically, and large people are there, it is difficult for us to assess each and every thing, right? So instead of that, we are using the simplified version. So we are taking one index state from each segment. If you see the oral hygiene index, original version, in that we have the formula like debris index and character index. So total debris score or total character score divided by number of segments. Whereas if we take the simplified version, it is number of surfaces examined. Okay, so from each segment, one index state we are taking. Okay, so what are the instruments supposed to be used? The same instruments what we will be using for oral hygiene index, original, the same, like mouth mirror, sickle experiment. So whenever we are examining, we are supposed to have a cotton holder also and a cotton in our fingers. So the instruments like mouth mirror, if you see at the back side, you will have number 5. Understood? So for pediatric children, the number will vary. Similarly, for examining the adenoids and tonsils, the number will vary. If you see the ENT specialist, they will also have a mouth mirror, but the size of the head will be the same, whereas the length of the mouth mirror, the handle, it will be very long. Understood? So these are the instruments we are supposed to use. So for example, if you are taking on the maxilla, that is first quadrant. So this is the first quadrant, second and third quadrant. Similarly, for the mandible, we have fourth quadrant, fifth quadrant and sixth. Right? The segments in other words. So if you take for 1/6, make sure that your probe, that is the sickle explorer, that is the concavity side. This is the convex portion and this is the concave portion, right? So this concavity should be always parallel to the long axis. For example, if you take, this is the long axis of the tooth, the explorer should be parallel. Understood? So the tooth will be first divided into 3 parts, right? One is occlusal 1/3, middle 1/3 and cervical 1/3. Correct? By drawing 2 horizontal lines, we have cervical 1/3, middle 1/3 and occlusal 1/3. Correct? So this will help us in determining the score. What kind of score has to be given for the distribution of the debris or even the calculus. So once you keep the probe, we should always keep parallel to the long axis of the tooth and draw the tooth. That is from distal to mesial. Pass the probe gently. Understood? From distal to mesial third. So when you pass the probe and when you see under the light, if you get a debris, then we will be giving score 3 because the debris is seen in the occlusal 1/3 itself. Understood? If not, then again take a cotton and wipe out the debris. Okay, once it is done, then go for the next tooth. In case if it is for oral hygiene index, the original version, because we are supposed to examine all the teeth, right? For example, if I am going with 1/7, first I will say occlusal 1/3. Okay, and then I will check, okay, no debris is there, I will wipe it off, and then I will go to middle 1/3. Again I will check under the light. If it is there, I will give score 2. If it is not there, and again I will go to cervical 1. Understood? So this is the manner you are supposed to examine. For example, if it is anterior teeth, similarly the concave should be parallel like this. Okay? Understood? You are not supposed to keep like this. You are supposed to keep like this. Okay? The concavity. So from distal to mesial. So distal 1/3, mesial 1/3 and cervical 1/3. Okay, but the direction is from distal to mesial. Understood? So first we are seeing the incisal 1/3 and then the middle 1/3 and then the cervical 1/3. Clear? So the main purpose of assessing the oral hygiene index, either original version or the simplified version, is to assess the oral hygiene status of an individual. Understood? So in case of a single patient, we can go with original index because that will give us the complete status of a patient. In case when we are examining 100 people, when you are going for a camp, or when you are doing an epidemiological survey, so in that aspects, it is better to go with oral hygiene index simplified version. Understood? So clear? So later we will see in the patient.